Good morning, I'm Lowry Grant, Director of Charities, PKF-FPM Accountants, and this is the latest in our COVID-19 business support series. In this short video, I'm going to address three things: finance, operations, governance. But of course, I cannot but comment on the very generous and fantastic announcement yesterday of 750 million for the charity sector in the UK. 10 million of which we're assured by Brandon Lewis today is directly earmarked for Northern Ireland. This is fantastic news for the sector. The COVID-19 pandemic is severely impacting on Northern Ireland's charity sector, with many charities reporting absolutely no voluntary income and unprecedented demand in their services. Many are reporting that their trading operations have closed. The impact of coronavirus will, of course, depend on your particular charity sector, your funding sources, and the current models of your client-facing delivery. One thing, however, is absolutely certain: this is not business as usual. This is a time for strong and decisive leadership within the charity sector, with the absolute priorities being the health and well-being of our staff, our clients, and our trustees. About the 750 million, 360 million of that will be administered through government and public sector organisations and is earmarked for key services, things like the hospice, St John's Ambulance, Victims Charities, Vulnerable Children, Citizens Advice. 370 million will be administered through the National Lottery's Community Fund and is available for the support of small and medium-sized charities. And there's 20 million given to the National Emergencies Trust Fund. And in addition, our Chancellor has announced that he will match on a pound-for-pound basis the efforts of the BBC in their 23rd of April Big Night. One word of caution. In the Chancellor's statement, he also said, we will not be able to support every single charity. And that is a bit worrying. I believe our attention now should be focused on three areas: finance, operations, and governance. I think FOG is a very appropriate acronym at this time as we navigate our way through uncertainty and the fog of that uncertainty. Cash and liquidity during this time are absolutely key. Charities need to focus on reducing or postponing fixed costs, direct debits, standing orders, but always do this in conjunction with the direct debit holder. Speaking to funders to arrange interim or early payments against SLAs and grants, mapping out your cash flows with really prudent and conservative assumptions. Early indications, of course, are very positive. Funders and commissioners of service have responded very well and in a very constructive manner to requests. Early intervention and documentation with your bank is critical. Take advantage of the package of measures that have already been announced or in the public domain and are available through NI Direct. The Business Interruption Scheme, essentially an 85% guarantee by government up to 5 million and up to 250,000 no personal guarantees. Of course, this is only available to charities where more than 50% of their income comes from trading activities. Charities with retail arms may be eligible for support under the Retail Hospitality Grant Scheme, depending on their NAV. The Job Retention Scheme applies to all charities, to its employees, up to 80% of salary up to a maximum of £2,500 per month. Of course, this requires furloughing of those staff and must be carefully communicated and carefully documented. Time to pay by agreement with HM Revenue and Customs on PAYE, national insurance, and of course the relaxation of SSP rules will assist greatly in cash flow. We should, however, anticipate significant falls in our voluntary income. However, against this, there are a growing number of philanthropic and funding sources that are stepping up to the requirements for funding at this time. The way you carry out your work, whether it's client-facing support and service or administration, has, because of social distancing rules, changed. New models of delivery are inevitable, making use of modern technologies and keeping staff and client welfare and safety at the top of your agenda. Service delivery, including administration and support, must of course at all times be fit for purpose, even in this new world of coronavirus. keep a watch on things like GDPR, especially in a remote working environment. The senior leadership team must gain a perspective and grasp of all of the critical issues and develop coping strategies which are appropriate. Regular updates with the leadership team and the client-facing staff is absolutely critical. It's essential that you always keep your funders in the loop and make sure that they agree variations to the conditions that have been already specified and approved in the SLAs and grants. Always bear in mind, post-coronavirus, it's not what you think you've agreed, it's what you have agreed in writing that matters. Smart systems to manage our accounts, our administration, our annual audit, and our monitoring returns need to be implemented. Life must go on, even during coronavirus. Your governance responsibilities remain, and I would suggest at this time have become even more challenging, with board and various subcommittee meetings having to be conducted by telephone and video conferencing. Regarding AGMs, these might be quite difficult. Decisions to suspend these should be carefully recorded in minutes. There may be some difficulty getting accounts approved. Mason Hayes Curran solicitors have provided excellent advice in this on things like AGM and GDPRs. We've included a link below. Delays to account submission should be avoided. However, the Charity Commission for Northern Ireland have stated that if COVID-19 continues and you're going to be delayed, you must notify CCNI. You need to manage the charity's strategic response to this current crisis and the need to keep a watchful eye on the future. In the future, it's quite likely that discretionary spend by government and by individuals will reduce significantly. This will impact as they seek to repay the debts and recover from the debts incurred during COVID-19. Trustees need to consider their short, medium and long-term priorities, how these impact on the use of reserves. CCNI would encourage trustees to consider whether certain projects, spends, activities can be stopped or maybe delayed in order to concentrate on essential spending. It is essential to keep a close watch on the use of those things, restricted funds. The temptation in this environment is to spend restricted money on an unrestricted purpose. And of course, that's contrary to the Charities Act 2008 and also to the Statement of Recommended Practice for charities. It's essential to keep a close watch on the future. This coronavirus situation will end, and we as a sector will have to rise to the challenge of the aftermath, when social needs will have grown enormously, funding will be scarce. And as we look to rebuilding the charity's finances, remember at the end of this, many of our charities will have utilised a lot of their reserves and used up a lot of their cash and may even have incurred some debts. However, on the bright side, recovery, I am absolutely sure, will come. We as the charity sector must be ready to respond rapidly when that time comes. In the meantime, stay home, stay safe, and thank you very much indeed for listening.